क्योंकि जिहड़ियां बीमारियां हैगियां जिहड़ियां फिजिकल इलनेसिस भी जिन्हां नूं असीं कहने आ lot of them, not all of them, but lot of them are caused because of the mind. बहुत सारियां मॉडर्न लाइफ दियां हैगियां स्ट्रेस रिलेटेड हैगियां. स्ट्रेस इज़ ए माइंड प्रॉब्लम. So you can condition your mind not have stress, then you will possibly not have heart attack. You will not have, very few people will have migraine or irritable bowel syndrome, or there are so many other diseases like peptic ulcer. So most of the diseases are about the mind, and sometimes we are treating the physical diseases, and they can be treated with, most of them can be treated with chemicals. But awareness, knowledge is strength. अगर जानकारी है, if you have the knowledge, कि अगर पेप्टिक अल्सर है उन्होंने पेशेंट नीड्स काउंसलिंग आल्सो, विच इज़ ए काइंड ऑफ ए साइकोथेरेपी. सो ड्रग एडिक्शन इज़ ए मेंटल प्रॉब्लम, राइट? ओवर ईटिंग इज़ ए मेंटल प्रॉब्लम. यूजिंग टू मच मोबाइल इज़ ए मेंटल प्रॉब्लम. ठीक है. लूजिंग टेम्पर ऑन स्मॉल थिंग्स इज़ ए मेंटल प्रॉब्लम. डोमेस्टिक वायलेंस इज़ ए मेंटल प्रॉब्लम. सो देयर इज़ ए वेरी लॉन्ग लिस्ट. सो 1 in every 6 persons suffer from some kind of mental illness. बच्चों के विच है एंगजाइटी न्यूरोसिस है, एग्जाम रिलेटेड है, चिल्ड्रन कमिट सुसाइड, इवन मेडिकल स्टूडेंट्स डू दैट, इंजीनियरिंग स्टूडेंट्स डू दैट, ओवर स्पीडिंग है, देयर आर सो मेनी रिस्की बिहेवियर है. दीज आर मेंटल इशूज़. सो देयर आर लॉट ऑफ मेंटल इशूज़. आजकल जिन्ने भी थोड़े डॉक्टर्स है गया, लॉट ऑफ दैम दे कम टू मी कि बदले बच्चे साडी बदली नेड़े करा दो, आई हैव ए चैलेंज चाइल्ड, उन्होंने बिहेवियर है, हाइपरकिनेटिक बिहेवियर है, और सम काइंड ऑफ ऑटिज्म, और सो मेनी अदर काइंड ऑफ मेंटल डिसऑर्डर. यू पीपल हैव टू, यू सी, इफ द माइंड नोज देन द आइज विल सी, ईयर्स विल हियर. इफ द माइंड डजंट नो, सो यू हैव टू ट्रेन योर ओन माइंड, योर ओन सेल्फ. जे थोड़े को नॉलेज होएगी, सो यू विल बी एबल टू हेल्प मैनी मोर पीपल विदाउट मेडिसिन. देयर आर लॉट ऑफ डॉक्टर्स, they put patients on lot of medicines, but there are very few doctors who put the patients off the medicines. They try to manage the patients with minimum amount of drugs. So for example, even for hypertension or diabetes, diet has a role, lifestyle has a role. For obesity, lifestyle and diet, you can manage or delay these diseases with even lifestyle disorders. Now if the mind knows, if all of you know, ਤੁਸੀਂ ਹਰ ਸ਼ੁੱਕਰਵਾਰ ਡੈਂਗੂ ਤੇ ਵਾਰ ਕਰਦੇ ਹੋ ਕੰਪੇਨ ਕਰਦੇ ਹੋ. ਸੋ ਇਫ ਐਵਰੀਬੋਡੀ ਨੋਜ਼ ਕਿ ਇਹ ਜਿਹੜਾ ਹਾਊ ਦਿਸ ਲਾਰਵਾ ਬਰੀਡਸ, ਵੀ ਹੈਵ ਟ੍ਰੇਨਡ ਅਵਰ 20,000 ਆਸ਼ਾ ਵਰਕਰਸ ਫॉर ਦਿਸ. we have, I mean, so far we have maximum rains this year, we have maximum you see water stagnation and all this, but till date we don't have a single dengue related death. There used to be 40-50 every year. So there is more than 50% reduction in dengue cases. So you see, if the mind knows, then you can help the society without drugs also, or with very few drugs, and particularly for pregnancy. So or even anemic kids, you can manage it even with the dietary modification, with sanitary habits, washing hands, wearing at least slippers, not walking barefoot. So these are some of the things which everybody has to learn, and particularly about the psychiatric illnesses. At least you should be able to suspect, you should be able to screen, then refer the patient to nearest sub-division hospital or district hospital. In any case, you have AIIMS Mohali also, you have PGI, you have Sector 32, Sector 16. So help is available for Mohali people. So you only have to suspect, screen, manage if you can. If you cannot manage, discuss with your peer group, and if still you cannot manage, then refer the patients. So if you give him medicine, if somebody is coming to you with a problem like migraine, you give him analgesics, you help him for next 6 to 8 hours. But if you tell him what is his condition and why is it happening, what can he do to change it, so you can help him for rest of his life. ਤੁਸੀਂ ਚੰਡੀਗੜ੍ਹ ਜਾਂਦੇ ਹੋ, ਰੋਡ ਤੇ ਜਾਂਦੇ ਹੋ, ਪੁਲਿਸਮੈਨ ਨੂੰ ਦੇਖ ਕੇ ਹੈਲਮਟ ਪਾ ਲੈਂਦੇ ਹੋ ਨਾ, ਪਾਉਂਦੇ ਹੋ ਨਾ. ਕਈ ਬੰਦੇ ਹੁੰਦੇ ਆ ਜਿਹਨਾਂ ਨੂੰ ਪਤਾ ਕਿ ਸਿਰ ਤਾਂ ਮੇਰਾ ਆਪਣਾ ਹੀ ਹੋ, ਜਦੋਂ ਸਕੂਟਰ ਸਟਾਰਟ ਕਰਦੇ ਆ ਪਹਿਲਾਂ ਹੀ ਸੀਟ ਬੈਲਟ ਲਾ ਲੈਂਦੇ ਆ, ਜਾਂ ਹੈਲਮਟ ਪਾ ਲੈਂਦੇ ਆ। ਸੋ ਦੈਟਸ ਅ ਬਿਹੇਵੀਅਰ ਚੇਂਜ। ਸੋ ਸਿਮਿਲਰਲੀ if there is a bereavement in the family, some people can't cope with it. Okay? So this is again it's a mental kind of situation which you can help. Sudden loss of near and dear ones, or there are so many other conditions, because you are dealing with the 90 to 95% of the population. I mean PGI or the tertiary care institutes, they deal with 5 to 10% of the population. How many people can reach PGI? So most of the people will come to you. If you see 40 patients, 50 patients every day, how many of you need to go to even Mohali? Maybe 1 or 2, maybe 5, not more than that. So you are dealing with the majority of the population. So it's very important that you should know it, and you should train your Ashas. It's very important. She is there available 24/7. At least she should know how to do the crisis management. Convince the person कि कल ਨੂੰ डॉक्टर साहब आएंगे अपने हेल्थ एंड वैलनेस सेंटर वाले, तो मैं ਤੁਹਾਨੂੰ ਨਾਲ ਲੈ ਕੇ ਚੱਲਾਂਗੀ, ਐਂਡ ਦੈਨ ਯੂ ਕੈਨ ਕਨਵਿੰਸ ਦਾ ਪੇਸ਼ੈਂਟ ਕਿ ਕੋਈ ਨਹੀਂ ਤੁਸੀਂ ਆ ਕਰੋ, ਆ ਚੀਜ਼ਾਂ ਕਰੋ ਤੁਸੀਂ। ਦੈਨ ਇਫ ਨੀਡ ਵੀ ਤਾਂ ਡਾਕਟਰ ਪੂਜਾ ਹੈਗੇ ਆ, ਡਾਕਟਰ ਸੰਗੀਤਾ ਹੈਗਾ, ਮੈਂ ਤੁਹਾਨੂੰ ਉਹਨਾਂ ਕੋਲ ਲੈ ਜਾਵਾਂਗੀ। ਸੋ ਇਹਦਾ ਜਿਹੜੀ ਤੁਹਾਡੀ ਬਿਮਾਰੀ ਹੈ ਇਹਦਾ ਵੀ ਹੱਲ ਹੈਗਾ, ਇਹਦਾ ਵੀ ਇਲਾਜ ਹੈਗਾ। ਇਟ ਇਜ਼ ਕਿਉਰੇਬਲ ਐਂਡ ਇਟਸ ਟ੍ਰੀਟੇਬਲ। ਉਹਦੇ 'ਚ ਜਿਹੜਾ ਲੋਕਾਂ ਨੂੰ ਹੁੰਦਾ ਨਾ ਕਿ ਜੇ ਉਹਨੂੰ ਕਹੋ ਵੀ ਅਸੀਂ ਸਕਾਇਟਰਿਸਟ ਨੂੰ ਦਿਖਾਉਣਾ, ਕਹਿੰਦੇ ਨੇ ਮੈਂ ਕੋਈ ਪਾਗਲ ਹੈ, ਮੈਨੂੰ ਪਾਗਲਾਂ ਦੇ ਡਾਕਟਰ ਨੂੰ ਦਿਖਾਉਣਾ। ਸੋ ਜ਼ਰੂਰੀ ਨਹੀਂ ਕਿ ਬੰਦਾ ਪਾਗਲ ਹੋਵੇ। ਸੋ ਉਹਦੇ 'ਚ ਬੰਦੇ ਨੂੰ ਕੋਈ ਸਟ੍ਰੈਸ ਹੈ, ਐਂਗਜ਼ਾਇਟੀ ਨਿਊਰੋਸਿਸ ਹੈ, ਡਿਪਰੈਸ਼ਨ ਹੈ। ਡਿਪਰੈਸ਼ਨ ਹੁੰਦੀ ਹੈ, ਸਟਾਰਸ ਨੂੰ ਹੋ ਜਾਂਦੀ ਹੈ, ਬਹੁਤ ਅਮੀਰ ਬੰਦਿਆਂ ਨੂੰ ਜ਼ਿਆਦਾ ਹੁੰਦੀ ਹੈ, ਉਹਨਾਂ ਨੂੰ ਵੱਡੇ ਵੱਡੇ ਬੰਦਿਆਂ ਨੂੰ। ਸੋ ਯੂ ਕੈਨ ਹੈਲਪ ਦ ਪਰਸਨ ਕੋਪ ਵਿਦ ਸਟ੍ਰੈਸ। ਸਿਮਿਲਰਲੀ ਫॉर particularly for drug addiction, ਸਾਡੇ ਮਾਨਯੋਗ ਮੁੱਖ ਮੰਤਰੀ ਭਗਵੰਤ ਮਾਨ ਜੀ ਔਰ ਸ਼੍ਰੀ ਅਰਵਿੰਦ ਕੇਜਰੀਵਾਲ ਜੀ, ਉਹਨਾਂ ਨੇ ਹੈਲਥ ਔਰ ਇਹਨੂੰ ਐਜੂਕੇਸ਼ਨ ਨੂੰ ਆਪਣੀ ਪ੍ਰਾਇਰਟੀ ਬਣਾਇਆ। ਐਂਡ ਵੀ ਆਰ ਟਰਾਈਂਗ, ਆਈ ਨੋ ਦੇਰ ਆਰ ਮੈਨੀ ਡਿਮਾਂਡਸ ਜਿਹੜੀਆਂ ਤੁਹਾਡੀਆਂ CHOs ਦੀਆਂ ਪੈਂਡਿੰਗ ਹੈ। ਸੋ ਆਈ ਐਮ ਅਵੇਅਰ ਆਫ ਦੈਟ ਐਂਡ ਵਰਕਿੰਗ ਔਨ ਦੈਟ ਆਲਸੋ। ਸੋ 1000 ਡਾਕਟਰ ਅਸੀਂ ਰਿਕਰੂਟ ਕਰ ਰਹੇ ਹਾਂ, 1000 ਡਾਕਟਰ। ਸੋ ਆਈ ਵਾਂਟ all of them to be trained in, even you should be trained in critical care. If a patient comes, you should be able to keep him alive, him or her alive, till advanced life support or any support help comes, ambulance comes, do CPR. You should know, definitely know basic life support, but you should also know, medical personnel should also know advanced life support. You should know how to intubate a patient and use the ambo bag and the oxygen cylinder. These are available even in PSCs. Is it available? No. Oxygen cylinder. You have oxygen.
Yes.
You have ambo bag.
Yes.
You have the endotracheal tubes. But I am sure none of you can do the intubation. I am very sure about it. But we will get you trained. If you are willing to get, are you willing to get trained? You should be able to save a life. If the patient comes to the hospital, it's a primary health care unit. You should be able to do that, and you should be trained to do that. Similarly for drugs. Now you are working in a village. Talk to your ASHA worker. You have a village health committee, health and nutrition sanitation committee. So you have 15 members in there. You should know who is taking hard drugs. If you can do one thing, that anybody who is using injecting drugs, first provide him with the safe syringes. Tell him that don't share syringes. You are injecting, okay, take this from me. Then talk to the psychiatrist that there are 5 people who are injecting in my village. Tell them don't inject. We will give you liquid methadone. I will put drops in your nose. Do that. Because make your village drug free, make it dengue free, and make it free from communicable diseases. I will honor your 15th of August. ਮੈਂ ਤੁਹਾਨੂੰ ਇਨਾਮ ਦੇਵਾਂਗਾ 15 ਅਗਸਤ ਨੂੰ ਬੁਲਾ ਕੇ, 26 ਜਨਵਰੀ ਨੂੰ ਬੁਲਾ ਕੇ ਤੁਹਾਨੂੰ ਆਨਰ ਕਰਾਂਗਾ ਤੁਹਾਡਾ, ਠੀਕ ਹੈ। ਆਪਣੇ ਪਿੰਡ ਦੇ ਵਿੱਚ ਤੁਹਾਡੇ ਕੋਲ ਕਿੰਨੇ ਪਿੰਡ ਹੈ? ਇੱਕ CHO ਕੋਲ 7. So if you can make 7 villages free, I am not saying ਕਿ ਲੋਕ ਦਾਰੂ ਨਹੀਂ ਪੀਂਦੇ, ਮੈਂ ਕਹਿੰਦਾ ਜੇ ਗੋਲੀ ਵੀ ਲੈਂਦੇ ਆ, but even if you can stop people from injecting drugs and move to liquid methadone or oral substitution therapy, it's a huge success. HIV, hepatitis B and C spread will stop. That is what we want. If every CHO does, we have 3000 of them. ਉਹਦੇ ਚੋਂ 26-2700 ਤਾਂ ਹੈ ਇਸ ਵੇਲੇ ਪੋਸਟਡ ਹੈਗੇ ਆ। ਸੋ ਸਿਮਿਲਰਲੀ ਵੀ ਹੈਵ ਇਕੁਅਲ ਨੰਬਰ ਆਫ ਮੈਡੀਕਲ ਆਫਸਰ, 1000 ਜੁਆਇਨ ਕਰਕੇ ਉਹਨੇ ਹੋ ਜਾਣਗੇ। ਦੈਨ ਵੀ ਹੈਵ ਦ ਸਪੈਸ਼ਲਿਸਟ ਡਾਕਟਰਸ, ਦੈਨ ਵੀ ਹੈਵ 50,000 ਨਰਸਿੰਗ ਸਟੂਡੈਂਟਸ। ਉਹ ਆਉਂਦੇ ਆ ਵਿੱਚ ਤੁਹਾਡੇ PSC 'ਚ ਆਉਂਦੇ ਹੋ। They come for community training. Let them go to the community. Teach them about this Har Shukravar dengue ward. Do it on any other day. Whenever they come, take them to the village. Check every house. Check their desert coolers. Check their fridge ਦੀ tray ਜਿਹੜੀ ਹੁੰਦੀ ਆ, जो पंछियों वास्ते कटोरे रखते हैं, check all this and tell them about drug addiction. First thing is that the students, they have to protect themselves. Say no, whether it is smoking, whether it's any kind of other soft drugs or medical drugs, not only hard drugs. They should protect themselves, and then they should also join you. You see, if Asha work, you and the village state committee, if we all try, we can do it. If only psychiatrist or the health minister or the health secretary or the doctors in PJ try, then it will not happen. So the change has to start from the village, it has to start from the mohalla, and it has to start with you, with your knowledge. So मैं उम्मीद करता कि तुसी जड़ा ये अपना माइंड प्रोग्राम हैगा ਇਹਦੇ ਵਿੱਚ ਮੈਂਟਲ ਇਲਨੈਸਸ ਬਾਰੇ ਆਪਣੇ ਆਪ ਨੂੰ ਐਜੂਕੇਟ ਕਰੋਗੇ. ਡੂ ਵੀ ਹੈਵ ਅ ਮੋਡਿਊਲ ਕਾਈਂਡ ਆਫ ਥਿੰਗ ਫॉर them? We have a module. So you must read the module, share that knowledge with everybody, spread that knowledge. If you have a somebody, retired teachers, retired ex-servicemen, form a group, bring them into your Sehat committee. So I'll come and join your Sehat committee one day for village level activities. Plan your activities. How your people can be, free from drugs. How can they be free from sickness and misery? How can you have the healthiest village in Punjab, including the sanitation measures? Educating them that keeping the village clean, free from flies and mosquitoes. How does it help? How does it bring down diseases? And not burning paddy husk, because it's the air. You see, the air of that paddy husk may or may not affect people in Delhi, but it will definitely affect you and your kids and your pregnant wife or whatever it is. You should know how to. I'm sure you know how to recognize a high risk pregnancy. So that care should be a continuum, and no lady should be pregnant, preferably before she decides to conceive. But if she has conceived, then it is possible. The 9-month period is long enough. Even if you take care of her proper diet, exercise, maybe yoga and nutritional supplements like iron, folic acid. So nobody should be, definitely not anemic when she delivers the child. And no school kid should be anemic when they leave the school. And if you are trained in advanced life support, every kid who leaves the 10th class or the 12th class, they should know what is first aid, what is basic life support. They should know how the diseases, how these hookworms and other worms get into your tummy, from where whether it's on the food, they get it from the toe of your feet. So if the children know all this, they will take precautions. They will be wiser. Just washing hands before eating food, and very simple habits. Brushing their teeth in the morning, they must doing it. Keeping their nails smart, and brushing their teeth at night before they go to bed. So if you can teach them simple things, and if you can teach, if you know what is the ideal diet. We have given a chart. We are working on sudden cardiac death. Why sudden cardiac death? Something wrong in the food supplements. Take only natural foods. That is the simplest solution. We will be testing food supplements, and you see, the diet for a pregnant lady, the diet for gym goer. We have given everything. We have given the detailed guidelines. Have you seen it? You can follow my page.